Tiffany, my name is Danielle.
Hello.
I'm going to be your dental hygienist today.
Hi.
So today we're just going to start with a quick intraoral and extraoral examination. It's going to check for any abnormalities and then like a brief cancer check to make sure everything's looking good.
Okay.
So, Tiffany, I noticed while doing your intraoral and extraoral exam that your enamel is being eroded away, specifically on the lingual side of your teeth, which is the part closest to your tongue. I just wanted to know, do you have any problems with acid reflux? Do you typically get like any sort of acid feeling in your mouth that would cause you to have erosion on your teeth?
Well, if I can be honest, sometimes I start to eat a lot and I feel fat, so I force myself to throw up. I don't do it too often though, maybe about once a week. So.
Well, thank you for sharing. I know this can be a very difficult subject to talk about, and I'm going to ask you a few follow-up questions about this if you don't mind.
Okay.
When did you start developing this pattern of behavior?
I'd probably say about 1 year ago is when I started doing this.
And what does your day-to-day experience with bulimia look like?
So typically I eat a bunch of food in one sitting and then I feel really gross, so I either take laxatives or I force myself to throw up. I feel like that's usually what I do, is I force myself to throw up because it gives me instant relief. And then I also just exercise a lot to burn off calories.
And when you're going through these periods where you're eating a lot or binging, what foods do you typically eat?
I usually eat a lot of like unhealthy foods, I would say. Okay. It's just whatever I'm craving, but maybe like pastas and like candy and salty foods, just probably stuff that's not as good for me.
And is this something you've ever mentioned to your doctor, like your primary care doctor, or have you seen a counselor or anyone about this condition?
No, you're the first person that I've told.
Well, thank you. I'm here for you, and I would really like to help you. So regarding your teeth, have you experienced any sensitivity?
Yeah, I have a lot of sensitivity, especially to cold foods.
Yeah, so this is really normal with your condition. This is due to you have an increased sensitivity due to the lack of enamel on your teeth from the acid wearing away the enamel. So try to avoid any super cold or super hot foods to help with the discomfort.
Well, what about just in general? I feel like I always have sensitivity even when not eating cold foods.
Yeah, so some of the products that you use at home can help with that. So you should definitely probably switch to Sensodyne toothpaste. Okay. It has an ingredient in it that can help with sensitivity. Do you feel like you've noticed any dry mouth or changes in your saliva flow?
Yeah, I feel like I drink so much water and I still feel dehydrated throughout the day and my mouth just feels so dry all the time.
Yeah, so dry mouth is a common symptom with bulimia. So what I would recommend is a product called Biotene. You rinse with it twice daily for 30 seconds and it helps alleviate the dryness that you have. I also noticed a couple lesions in your mouth. Do you feel like you get those often?
Not too often, maybe 3 times a month. But when I do get them, they're really painful and they hurt really bad.
So Biotene can also help with your discomfort. I noticed some redness on your throat. Do you experience any pain on your throat?
Yeah, I always have a sore throat, like every day.
Okay, so I've noted everything in your chart. I'm going to refer you to a therapist so that you can get help with some of the bulimia problems. And hopefully over time it'll alleviate the symptoms related to bulimia.
Okay.
I also highly suggest that you talk to your primary care doctor.
Okay. I'm really scared to open up to anybody about this. I'm afraid of being judged by anybody.
Tiffany, I'm so sorry that you feel that way. But as healthcare professionals, we're just here to help and we want to do what's best for you.
Thank you so much, Danielle. I really appreciate your help and your honesty in pushing me towards getting better because I know this is a problem.
You're very welcome. I'm always here for you. Please take care.
Thank you too.
What? Hold on, let me read this. For being Also,
Hey, we got pretty far.
okay.